Good afternoon, everybody, and welcome to our next webinar from the Nevada Minority Health and Equity Coalition on the impact of COVID-19 on vulnerable populations. Today, we are most fortunate to have a great panel for you all. Our focus today is on the LGBTQI+ community and the impact of the COVID-19. Moderating with me today, I am so happy to have a friend and colleague and somebody who I respect highly in our community for all the work that he does. Not only with the American Lung Association, but then he also is the host for Compassionate Las Vegas. If you haven't had a chance to check that out, please do. Will Rucker is joining me today as our fellow moderator, my fellow moderator, and I will turn it over to him in just a bit. First, let me do some of the business. Let me thank all of our co-sponsors for this webinar series, the UNLV School of Public Health. Thank you, the Nevada Minority Health and Equity Coalition, the Center for Health Disparities and Research, also the Dreamsicle Kids Foundation, and the Nevada Commission on Minority Affairs have all contributed and helped support these webinars. And so again, today we are going to be touching on some very serious topics in terms of the impact on vulnerable populations. We'd like to also thank the Department of Health and Human Services and funding from the CARES Act that is supporting financial support for some of the current grant work that we're doing with some of the presenters today who will be on this panel, and work that's coming out of UNLV School of Public Health. So with that, welcome everybody. Please remember to keep yourself on silence while the presentations are going on. If you want to type questions into the chat, that is fine. We'll try to respond to them either during the session or at the end of the session during the question and answer session. So with that, welcome everybody, and I will turn it over to my fellow moderator, Mr. Will Rucker.
Well, thank you, Jose. Good afternoon to each of you. As Jose mentioned, I am Will Rucker, and I have the pleasure of serving as your moderator for this webinar. This topic is personal. As a member of the LGBT community, as a health promotions professional, as a human being, COVID-19 has touched my life in far too many ways. Today, you will hear presentations from 5 speakers who will share insights and expertise. Dr. Jennifer Farr, Associate Professor at the UNLV School of Public Health. We will also have Dr. Lauren Chappell-Love, psychologist at Psychological Solutions for Nevada. Following Dr. Chappell-Love will be Vince Collins. He is the Director of Operations at the LGBTQ+ Center of Southern Nevada. Next will be Andre Wade, State Director at Silver State Equality. And finally, Dr. Jason Flatt, Assistant Professor at the UNLV School of Public Health. Following the presentations, there will be a Q&A session. So feel free to type your questions in the Q&A box right here on Zoom. And if you are joining us via Facebook, please submit your questions through the comments box. Now, it is time to get started with our first speaker, Dr. Jennifer Farr. Dr. Farr is an associate professor of environmental and occupational health in the UNLV School of Public Health. Her research focuses on identifying health disparities among vulnerable populations, including people who identify as LGBTQ+. Please welcome Dr. Farr.
Thank you, Will. I appreciate that introduction, and thank you to the Minority Health and Equity Coalition for inviting me to be a speaker today. I really appreciate it. So I wanted to kick off this panel and talk about and lay the foundation for why we should consider COVID's impacts on LGBTQ+ populations. Are they more vulnerable to COVID and COVID-related impacts when we compare them to non-LGBTQ+ populations? We would argue yes, hence that's why we're having this panel today, and we have this great esteemed speaker speaking today. And those risks for those COVID-related impacts really fall into 2 sort of buckets, right? We have health-related risk factors, and we have socio-demographic related risk factors. And I'm gonna give you some examples of both of those during my presentations. So let's go to the next slide, please. So when you look at health-related risk among LGBTQ populations, when we compare people who identify as LGBTQ+, we know when we compare them to cisgender heterosexual populations, that they have higher rates of HIV and some forms of cancer, which leads them to be immunocompromised, and which lowers their ability to resist infections like, a COVID infection or something like that. The hot off the press, I just got this article this morning in my inbox. They've done a really quick study just looking at HIV and people who have severe cases of COVID. And what they're finding is actually sort of good news, right? Is that there's only about 1% of people, there's a study in the UK, there's another study in New York, and 1% or less than 1% of people who have a severe case of COVID are also HIV positive. And they think there's some relationship between the antiretroviral therapy that people who have HIV are on that impacts COVID, right? So there may be some positive coming from being on antiretroviral therapy, but much more needs to be learned about this. We really need a lot of research done in this area and in all the areas looking at LGBTQ populations and how they're impacted by COVID. People who identify as LGBTQ typically are more likely to smoke or use tobacco or use marijuana. And if they're doing those things through smoking, it can compromise their lung function. COVID compromises lungs, so there can be a relationship there. People who identify as LGBTQ are more likely to have the comorbidities that result in either a severe case of COVID-19 or a COVID-related death. Those include diabetes, asthma, and hypertension. So again, compared to cisgender heterosexual people, they're more likely to have those risk factors. And LGBTQ people are more likely to experience poor mental health. So they're more likely to experience depression and anxiety. And we're seeing that, COVID-19 can exacerbate those things. So it could increase the amount of depression or anxiety that people are experiencing. Next slide, please. So we're also going to think about some of those socio-demographic risks that LGBTQ people have that could put them at increased risk for either COVID or, impacts from COVID-19. Again, people who are LGBTQ compared to cisgender heterosexual people are more likely to experience poverty. They're more likely to lack health insurance, and they're more likely to be unemployed. And then you put COVID-19 on top of that, and they're more likely to experience those things to a greater extent. Also, people who don't have access to health insurance, they may delay seeking health care because they don't have insurance because of the cost of care. Or we also know that LGBTQ people, just in general, are more likely to delay seeking healthcare because they've experienced stigma or discrimination, or they're concerned about experiencing stigma or discrimination. And this is really important for us to think about as we're trying to get people to, go seek healthcare to get tested for COVID. Once the vaccine has been approved and is available, trying to convince people to go get immunized against COVID. So we need to think about these things as we're developing our policies. People who identify as LGBTQ+ have a greater risk of domestic violence and lack of social support. And again, just looking at recent things that have been published out there, most of this is really focused on youth and young adults who are LGBTQ+ during this time of COVID. So you have, maybe high school students who are now forced to spend more time with a parent who's unsupportive of them. And so that puts them at greater risk maybe of experiencing some violence at home. And then there's been some studies looking at college students who are LGBTQ+. So they've been able to leave home. Now they're at college, they're on their own. Here at UNLV, we have a dorm that's specific for LGBTQ+ students. So they have a lot of social support. They have a very supportive environment. And then once college is shut down and they have to go back home, now maybe again, they're living with an unsupported parent and they're broken away from their sense of social support that they have established at a college campus. There is the risk of LGBTQ phobia that's out there. It seems like this comes up every time there's some sort of disaster or epidemic that happens. Now we're hearing that COVID-19 is God's punishment against homosexuality. We heard it with HIV, we heard it with 9/11, we hear it, but those things are out there, and it could put LGBTQ folks at greater risk for, mental health, like depression, anxiety, and those sort of things. So I like this final quote. So all of these things, the health risks, the socio-demographic risk, all create a potential devastating constellation of risk for LGBTQ plus to experience either greater risk of COVID or greater risk of the impacts of COVID-19. Let's go to the next slide. We're going to talk about, COVID hasn't been around that long. I mean, it seems like forever, that we've been self-isolating and, not being able to spend time with our friends and everything. But as far as doing studies and getting stuff published, COVID hasn't been out there that long. But there are a few things starting to get published about the impacts of COVID-19 on the LGBTQ plus community. So the first study that we'll talk about is looking at the impact of COVID-19 on MSM folks in America. And when they were asked to compare their life in April of 2020 to previous to April of 2020, they reported that they have a significant decrease in their quality of life. They have increased anxiety. They've had to disconnect from their friends, and all of this is just, leading to worse mental health among this group of folks. They're having more difficulty, so more difficulty than before COVID-19, having the economic resources to buy food, to pay rent. They experienced decrease in hours at work. They've experienced job loss. So this impact of COVID certainly is affecting this group of folks. They reported having difficulty accessing HIV and STI testing and then STI treatment. I guess the good news to come from this study is that very few are having trouble getting access to their HIV medication, so they're still able to access their pharmacist, but several reported difficulty getting their HIV care visits scheduled. So actually being able to go see their HIV provider became much more difficult during COVID than it was before, and also difficulty having laboratory testing completed. Next slide, please. The next study looked at depression and anxiety among sexual and gender minority folks. This is also in the United States. And these results came from the Pride survey that's going on. Some of you may be very familiar with it. Some of you may be participating in the Pride survey. But they compared depression scores. So participants took a depression and anxiety test in June of 2019, so way before COVID. And then they took that test again and got those scores for April of 2020. So, a good month into the pandemic. And they saw increases in both depression and anxiety scores among SGM populations. Let's go to the next slide, please. Then the final study that I'll talk about is, so this is a global study. So not just in the United States, but globally, looking at MSM and the impact that COVID and the COVID response has had on people who identify as MSM. So they reported increases in anxiety and depression. Men who have sex with men who are also living with HIV reported having much more difficulty receiving their COVID-19 financial benefits compared to MSM folks who aren't living with HIV. So even though they're both sexual and gender minorities, those who were also living with HIV experienced even more difficulty financially than people who are not living with HIV. And again, globally, MSM who are living with HIV, about a quarter of them lost access to their HIV provider, and about 20% of them had difficulty refilling their antiretroviral medicine. So that's really very bad. If people don't have access to their HIV medications when they're HIV positive, that could be really traumatic health-wise and otherwise. Let's go to the next slide. So bringing it home to here in Southern Nevada, so just in conversations with our Dr. Brian Labus, our great epidemiologist here who's working on the COVID response. The Southern Nevada Health District just a couple of weeks ago started including sexual orientation and gender identity, so it was SOGI questions on the standard interview that they ask people once they find that they've had a positive COVID test. Results are not available at this time because it's just so new. They just very recently included these questions. But Dr. Flatt and I are communicating with Southern Nevada Health District because we really do want to have a good understanding and get good data to find out, are people who identify as LGBTQ LGBTQ plus, are they having increased rates of COVID-19? Are they having worse outcomes? Do they differ based on socio-demographic characteristics and people who are, cisgender heterosexual folks? So we really need to do some research using this data, and hopefully we'll be able to do some of that and get the results out pretty quickly. Let's go to the next slide, please. So I found this from one of the, again, very recent articles published looking at LGBTQ plus and COVID, just not only during COVID-19, but also looking beyond that. So some of the things, what do we need to do? What do we really need to focus on? We need to ensure that LGBTQ plus patients are receiving culturally competent care from providers who've been trained, right? Not just during COVID, but all the time, but particularly during COVID. We also need to update our systems. Southern Nevada Health District has just done that, but to be able to capture information about those SOGI questions, right? So that we can really understand how are LGBTQ plus people being impacted by COVID-19. Right now, there is no morbidity or mortality surveillance that includes LGBTQ plus questions, so we can really tease out that information and then really tailor our interventions, right, to be able to reach those folks. We really need to have more research that's specific to LGBTQ plus people to really understand what they're experiencing during COVID-19. Not just rates of COVID, but all those other impacts, right? Like unemployment, maybe, domestic violence, depression, anxiety, all of those things. And lastly, I'd like to point out, speaking out as a proponent of LGBTQ plus health, right? We can advocate to make sure that, LGBTQ plus people are receiving culturally competent care, they're being recognized in our data capture system, they're being included in the research, and all of those sort of things. So with that, thank you for having me. I look forward to answering any questions later, and I'd like to hand it back over to Will.
All right, well, thank you, Dr. Farr. What an informative presentation. Our next speaker is Dr. Lauren Chappell-Love. Lauren Chappell-Love is a licensed counseling psychologist. She completed a bachelor's degree focused in forensic psychology in 2007 at Bay Path University. Her master's in forensic psychology in 2010 at the Chicago School of Professional Psychology, and then went on to secure her PhD in counseling psychology in 2018 from the University of North Dakota. She earned additional experience in a pre-doctoral internship with the Department of Justice, Federal Bureau of Prisons in 2018, and completed postdoctoral training in 2020, this year, at a forensic private practice. Dr. Chappell-Love's clinical experience primarily lies in forensic and correctional psychology. While in the community, she has worked with court-mandated individuals and in sexual health. She is focused on diverse populations and the ways that they process and can excel while living within systems of oppression and majority culture spaces. Dr. Chappell-Love, take it away.
Thank you so much, Will. So as we start to conceptualize this, I really love how Dr. Farr, first of all, really thank the Minority and Health Equity Coalition for talking about these things. I think being able to have a space where researchers are able to speak out on, well, certainly my small corner of it is the psychological impact, but also the public health concerns that are going on in our communities and within the communities that we serve. I think that in and of itself is one of the ways that we can start to push back at these increased risk factors. So as Will got into, my day job is talking about feelings in a prison, outside of a prison, and by night I go through research and do the other things that you're going to be hearing about when we speak about this. If we can go to the next slide, I want to, again, kind of parrot what Dr. Farr was speaking about as far as socio-demographic risks. Now those risk factors, that is my jam. That is those are the things that I tend to work a lot with. And so I wanted to start out kind of making a little a pyramid here, right? So starting at the international level, going to the community level, and then of course, how are we impacted on the individual level, which is typically some of the things that I do when I'm working with a patient one-on-one in a room, or when I'm going out into the community, things along those lines. At the international level, think of words like xenophobia, think of concerns like stigma, blame being placed upon certain populations, certain races, in particular the LGBTQ2S populations and community. This kind of feels like old hat to us, right? For our elders that have survived the AIDS and HIV pandemics and now endemic and things along those lines. Some of these words can be what we would call to be triggering. So at the international level and at even the national level, it makes a lot of sense that people at some point struggle with going through a pandemic. Frankly, this is a thing that I talk about a lot in the room as we say it. So when I'm speaking with a patient, and that means that whatever you're going through, there's an added layer of this is a traumatic event that we're all going through. At our community, the LGBTQ community level, there's those increased risk factors that Dr. Farr and other people are going to be speaking about that also impact us. And so it works in this stacking way. And what we know is that's how some people end up being harmed, by having those increased risk factors. And so when we're looking at things on the community level, increased unemployment, decreased emotion stability, or decreased like economic stability, if there are not a ton of jobs available, or if it takes months upon months for someone to reach or to receive their unemployment benefits, those things are impacting us. Now, when we take a public health perspective of that, the HRC was, I believe, one of the first ones to come out with that stat of the increased likelihood, I think it's around 17%, so almost 1 in 5 LGBTQ adults being uninsured. Now that, when you take a look at which populations are less likely to step forward, which populations are perhaps less, more likely to say, oh, I'm gonna wait it out for a week, I'm gonna take some ginger ale and see how this goes, as compared to, the 12% or so of non-LGBTQ adults. This is how we start to develop some type of a public health crisis, not based upon anyone being a bad person or anything like that, but based upon these vulnerabilities, these risk factors. So let's delve more into the community level. So we've got less money, potentially less stability, less opportunity to pay bills. When we start looking at how we can push back on some of these barriers, my ability to pay a bill, let's say my internet bill, to watch something about my community on Facebook Live, or that's coming out through the Minority and Health Equity Coalition, or my ability to pay internet to stay on with my friends. It's not in the olden days, as I used to say, like in 2019, where, oh, if I miss something with my friends, I can always hit them up next week. These things start to impact us at a much greater level. So we've also got potentially housing and stability, distrust of medical field and testing. All of these things in particularly are impactful for the LGBTQ community. And when we look at economic stability and security, it certainly becomes a public health issue, much in the same way that racism is, and certainly for BIPOC or QPOC individuals. On the individual level, this is where we really come forward to see the psychological impacts. So when we're talking about studies, those are the studies that are coming out that can talk about surviving and living and existing in a pandemic, and certainly in an endemic, can start to precipitate new psychological symptoms or psychiatric symptoms in individuals with no history of a past diagnosis. Now that becomes kind of a scary thing in my field, right? Also, we're starting to see, our research is trending towards, that it can potentially worsen psychological symptoms in those with extant or already historically having some type of diagnosis. I think Dr. Farr really spoke about that more recent Pride survey that noted an increase in both anxiety and depressive symptoms. That is exactly kind of what we're talking about here. On top of which, already brought up, is of course that LGBTQ youth tend to be at an increased risk for all of these numbers of mental health concerns. Next slide, please. So let's talk about the potential impact of physical and social distancing. I left this one blank because I couldn't even begin to fit all of the things on here. I'm not trying to be funny with you by any means, but when we take a look at traumatic symptoms, some folks start to exhibit these. When we take a look at the recent study mentioned, going from April to June, the slight increase, and in some cases significant increase in anxiety and depressive symptoms, that might be pulling back, feelings of guilt, feelings of loneliness. In psychology, we have what is the impact of the symptom? How long has it been going on? When did it start? A lot of those different things. So I'm going to throw several different terms out. It's not a situation where someone has necessarily got a diagnosis, but we recognize that COVID plus other risk factors tends to very much increase a person's likelihood to struggle in some of these areas. And they're serious things, right? So I usually describe things like PTSD, which by the way is not just for individuals who have survived a sexual assault or individuals who maybe have come back from some type of war zone or combat zone. These are also things that individuals who are maybe first responders are experiencing. And I'm starting to see in just the N of 1 study here, the folks that I end up speaking with, increases in symptoms. And I think that the research is also starting to, as Dr. Farr said, trickle out. It sometimes takes months and months for research to come out, although I think we've all been doing a great job in pushing it out. Take a look at PTSD symptoms. I'm really just talking about trauma-related symptoms. It might be an acute, meaning a short, or a chronic, meaning a prolonged amount of time. But you take a look at agitation, irritability, fear, flashbacks, insomnia, nightmares, guilt, loneliness. We already talked about that, pulling back, social isolation from the already potentially dwindling social supports, coupled with some of those community factors, as Dr. Farr brought up. So what am I going to do if I'm a 17-year-old that was out in college, or if I'm a 23-year-old that now has to move back home, and my family or my support system is not supportive of my identity? And what does that do? Well, typically that becomes very difficult for people. If you look at the next slide, please, you see, I think, the breadth of all of these concerns. We take a look at physical symptoms, high blood pressure, tension, headaches, things along those lines. And so the question becomes, now that I've scared everyone half to death, how can we minimize these risks? I recognize that I do not have a magic wand. I can't make COVID go away. What can I do if I see someone struggling? What can I do if I am the person struggling? And what can I do for my community if I just want to help? I think it's important to recognize that physical distancing does not necessarily mean social isolation. Social isolation is very, very different from I want to be at peace, or I want, just some solace, or I just want to hang out by myself and read a book. Social isolation looks like I'm pulling back the individuals that are there for me, right, wrong, weak or strong, but that tends to be potentially problematic for folks. That can potentially increase things that they're struggling with, depressive symptoms, anxiety symptoms, for example. I think when we take a look at how we on the community level can reach out, it's talking about like messaging to LGBTQ communities. In particular, how are we addressing folks? If I see an advertisement, who do I see on that advertisement? Is it someone that looks like me? Is it someone maybe I can trust a little bit? How do I know they can be trusted? And things along those lines. I believe that's going to be spoken about more later. It's reaching out. Minimizing this risk looks like, if I'm struggling with this, recognizing it's okay to be struggling with something right now, that a lot of folks are doing that, and that it's not something where I'm weak or I'm bad. Reaching out for services, reaching out to other folks, engaging in online activities. This can be for youth, this can be for adults. I don't care how creative you want to get, have fun. Being able to do karaoke on Zoom can, in a lot of ways, be a way for folks to connect, especially in LGBTQ communities, where a lot of the places that we end up connecting tend to be bars or things that are kind of more social events. I know I certainly missed Pride a lot this year. From that, if you move forward to the next slide, please. I wanted to provide some resources. Thankfully, we live in a state that has got a lot more awesome resources as well. But for folks to be able to reach out to and just know that there are clinicians that might not have had the exact experience that you had, but we are out here, and it is our job to be able to listen, and that sometimes can really help folks. If you go to the last slide, my heart is all aflutter. I talk all about the research. If you are also a research person like myself, there's some pretty good references here if you want to get into some of the really cool stuff that is coming out. And I thank everyone for listening, and thank you for this opportunity. Back to you, Will.
Wonderful. Well, thank you again, Dr. Chapel Love. I think we can all feel your passion. What incredible work. Our next speaker is Vince Collins. Vince is the Director of Operations at the LGBTQ Center of Southern Nevada. overseeing the daily operations of the organization's staff, facility, as well as the center's many programs and events. He has previously worked for organizations such as AIDS of Southern Nevada, AFAN, the Urban League of Southern Nevada, and Action Red. He has also worked in educating the public in health literacy, HIV treatment adherence, and facilitated health education risk reduction groups. Vince previously served as HIV services manager for the center, spearheading many programs, including its broad-based community HIV prevention campaigns. He also created an early intervention program for at-risk young males and allied men for HIV prevention. Vince, you are on.
Well, thank you, Will. And it's a pleasure to be here. I want to thank everyone who's presented today and thank everyone involved in organizing this webinar. I just want to focus on the HRC Foundation estimates that 14 million people in the United States are LGBTQ, and 2 million of them are LGBTQ youth. More than 5 million work in jobs that are more likely to be impacted by COVID-19. This includes those working in restaurants, in food services, hospitals, K through 12, and higher education and retail industries. The Human Rights Campaign Foundation states in their COVID-19 research brief, the lives and livelihoods of many LGBT community are at risk amidst the COVID-19 crisis. They list increased exposure, economic disparities, and barriers to care. Many LGBTQ people are employed in sectors that will be heavily impacted by COVID-19 crisis. LGBTQ people also face significant economic disparities compared to the non-LGBTQ peers, which means they often lack more resources and need to stay afloat during the COVID-19 crisis. LGBTQ people work in highly affected industry. LGBTQ people are poorer. Health coverage gaps exist. Older LGBTQ people face unique challenges, and queer people and youth face unique challenges. LGBTQ youth are more likely than cisgender and heterosexual youth to experience homelessness, unstable housing, and live in foster care, often due to family rejection. In fact, the HRC Foundation in 2018 LGBTQ Youth Report has documented how often LGBTQ youth face family rejection as 67% of youth reported to their family makes negative comments about LGBTQ youth. Moreover, the report on LGBTQ youth identifies 120% more likely to experience homelessness than a non-LGBT youth. It also estimates that 30% of youth in foster care are LGBTQ, and an estimate of 40% of homeless youth identify as LGBTQ youth. This means that many LGBTQ youth may heavily rely on food and resources provided by the public schools and child welfare agencies. Due to widespread school closures because of COVID-19, LGBTQ youth are at risk of accessing basic needs provided by schools. They may also be required to spend more time in unsupported environments, including home and environments where they face family rejection. I invite you all to read in more detail the HRC's COVID-19 brief. In a day in the life of the LGBTQ plus center under the grip of COVID-19 shutdown, how we pivoted. So how we pivoted when it comes to a together message rather than a social distancing protocol. We work very hard at it and many hours. In talking about the LGBTQ plus Center of Southern Nevada, before and after COVID, and our programming, community engagement and impact, let us focus on 3 areas: youth, senior, community wellness clinic services. And so the first part of that is before COVID. Youth services. The center saw an average of 80 to 100 youth between the ages of 13 and 24, divided over 4 various programs before both educational and emotional support groups throughout the week, along with supplemental activities and events, i.e. the youth prom, youth Thanksgiving, Stonewall the play, just to name a few. To address the food disparities some of our youth may be facing, the center provides a fully stocked food pantry and backpacks with sanitation supplies, bus passes, and some clothing items. In our senior program, the seniors provided, the center provided a 5-day-a-week afternoon senior community engagement and lunch and learn meal program. Activities also included field trips and holiday and birthday celebrations. Community and wellness clinic services. The center provided over 30 programs which met weekly, including Rainbow Praise Church on Sundays, the Gay Men's Chorus, and free HIV/STI testing, community shower truck services, and many educational events and harm reduction services. And after COVID, youth programming, we have seen an 18% uptick in our program engagement with youth between the ages of 13 and 17. And we have seen 98 to 80% drop off with youth, often between the ages of 18 and 24. Many youth are struggling with finding normalcy and focusing under these conditions, and in some cases completely stop trying and have disengaged from the center. Seniors, we have seen the 100% drop off in our in-person groups. However, the center continues to provide our meals program using CARE Act funds and partnering with volunteers and community partners as such as the Delivery with Dignity, which we have organized a volunteer driver service for seniors, delivering over 1,400 meals per month in the first 3 months of the shutdown. Community and wellness clinic services. Excluding our wellness clinic and supportive services, we have seen 60 to 70% drop off in our programs and our on-property patronages. We have also seen widespread increase in drug use and relapse, clients' mental health decay due to isolation and separation from friends and family, high numbers of HIV and STI transmission, emotional outbursts in group settings, patrons violently lashing out, destroying property, and threatening physical harm to themselves and others. So the silver lining, thanks to stimulus dollars, the center has not had any layoffs. We have never had to completely stop serving our community and providing many essential services and resources such as food, clothing, bus passes, and a $85,000 United Way provided rental and utility assistance for our clients. We strengthened our virtual presence and rolled out a 24-hour hotline for people who experience sexual violence and need of help. Our linkage to care programs in HIV, the trans referral housing program, and applications for Medicaid, access to computer, and our work in social justice campaigns. The list goes on. Our team and our commitment remain strong and stronger than ever. So thank you, Will, and thank you, audience.
And thank you. We really appreciate your presentation and especially appreciate the work you do and services you provide. Now, our next speaker is Andre Wade. Andre C. Wade is the State Director for Silver State Equality. In this role, he leads legislative, fundraising, and political efforts in this state right here. Previously, excuse me one moment. Okay, before he was there, he was the Executive Director of the Gay and Lesbian Community Center of Southern Nevada. With a bachelor's in psychology and a master's in public administration, Andre has worked in human services for more than 20 years in a variety of public and nonprofit contexts, including at the National Alliance to End Homelessness as a program and policy analyst. Andre has served on several boards and committees focused on LGBTQ equality and inclusion, such as the Human Rights Campaign's Steering Committee in Las Vegas, HRC's All Children's, All Families program, and the Cindy Lauper's True Colors Fund. Currently, Andre is the chair of the advisory committee for the Nevada Office of Minority Health and Equity. And now I will turn the program over to Andre.
Hello, everyone. I am getting everything set up here. It's glad to be with you all today. Really enjoyed listening to what my colleagues had to say, and I hope to not be terribly redundant. But a lot of the information that we cover is connected. And so Silver State Equality is a Nevada-based statewide LGBTQ civil rights organization. And our mission is to bring the voices of LGBTQ people to the institutions of power. And we do that by getting pro-equality candidates elected, passing pro-equality legislation and policy and advocacy and public education work. So what we are seeing nationally, a lot of my colleagues have already covered, but I'll just go over it a little bit more. A lot of folks in the LGBTQ community are engaged in the gig economy. And so as we all know, that took a major hit, and with employment benefits, it took a while for the state of Nevada to get their program up and running. So a lot of folks are struggling. Also, LGBTQ folks have high representation in the hospitality and entertainment industry, particularly in Southern Nevada. And as we all know, those industries took a big hit as well. As Dr. Farr mentioned, our community has high rates of smoking and comorbidities that they deal with. If you compound COVID with HIV/AIDS, either with medication access or having COVID and HIV and the implications there, then it is something to consider as it relates to overall healthy outcomes for folks. And as others have mentioned before, just the access to welcoming and inclusive healthcare providers is an issue, and it's something that we're always grappling with. And so many of us are charged with doing some cultural competency and cultural humility trainings for providers and caretakers. And so, again, when we talk about the LGBTQ community, one thing that's sort of unique is just how someone navigates their life. We have folks who navigate their lives in predominantly LGBTQ spaces. So they may go to a gay or lesbian bar, want to eat at Hamburger Mary's, go to the center for programming and support, seek out a doctor that's LGBTQ. And so they're mitigating their interactions with heterosexual and cisgender communities. And so when you have something like COVID that completely stops one's social interactions, it has this compounding effect. And if people don't have access to reliable internet service, then using technology can be difficult to get your socialization done that way. And as Dr. Farr mentioned, if you have a young person or really anybody who's in a household where they're not fully accepted or conditionally accepted by their family, and use being outside of the house as a way to cope and get released and to be at one with their identity. If they're at home with folks and they're not being accepted, then that can have a deleterious effect on one's mental health and their overall health outcomes. And so when COVID hit, what we first learned was about how the Black community in particular was affected. And for many of us, I think Dr. Chapel will attest to this, that typically when you come to data, that Black people were at the bottom of these measurements and outcomes. And it typically is something that is just seen as natural and it's accepted. But we're starting to have these conversations around racism as a public health concern, so we don't begin or continue to take the outcomes of Black people as a given. And so also we were starting to have these conversations nationally with the LGBTQ community advocates and policymakers about what could be done in states to collect sexual orientation, gender identity, and expression data in general, but also related to COVID. And so California passed a bill recently that will require the collection of SOGI data, and they're still working out some of the kinks because there's many jurisdictions and locales that are not collecting the data. And I just learned today in a work group that Rhode Island is beginning to collect some data when it comes to testing. New Jersey is trying to make headway in collecting data. They're just trying to figure out, is it something that they're going to do through a governor's executive order or through legislation? So it's on their agenda. In Pennsylvania, they were able to begin collecting data through a governor's order. They had some LGBTQ advocates that worked within the governor's office and within other departments. And so they were able to eventually create policies and procedures to start collecting data in Pennsylvania. Illinois is trying to do some work. And here in Nevada, back in June, Silver State Equality had some conversations with Dr. Whitley with the state of Nevada about collecting data related to COVID, SOGI data related to COVID. And so now, as Dr. Farr mentioned, we are collecting SOGI data when it comes to contact tracing. And so Southern Nevada Health District, of course, is one of those entities that are doing some of that work. And so as we began to push and advocate and raise awareness for it, we're lucky to have some coverage here in the state of Nevada about the COVID SOGI data collection, and then has some national press related to it as well. Recently, Silver State Equality has partnered with the center to conduct some listening sessions to grant from the UNLV's School of Public Health and the Nevada Minority Health Coalition. And so we are really thankful that we're able to partner with the center. Vince and I have been working together for a couple of years. We're friends. We always talk about how we want to do what we can to reach our community, specifically our Black LGBTQ community members, but just our over members. And so when this opportunity came about, we were quick to partner. The center has a particular reach in the community with the folks that they serve. We have a pretty good communications and digital team. And so we've been able to hold some listening sessions with one more to happen in December. But some of the preliminary findings, if I can, I miss it, let's see. Oh, yeah. Yeah, some of the preliminary findings is with contact tracing. And so we know that there needs to be training around collecting the data. Some of the hiccups that have happened and some of the stalling, not only in California, but in Nevada, is around practitioners, workers not being trained on how to ask the questions and not feeling comfortable. And so if you're not comfortable with something, then you just avoid it. And so the information isn't getting collected. Something to consider is transgender and gender diverse communities and their particular social networks and how they socialize. And so if folks are asked to engage in contact tracing and they are trans or gender diverse and are living either stealthily or they're not completely out in their family or friend group or however, it may become problematic. So we have to think about how we tailor contact tracing and other data collection measures when it comes to transgender and gender diverse communities. And also, usually when it comes to SOGI data collection, when you ask these questions that are demographic in nature, so I think Dr. Chapelov mentioned how this is data collection when we're asking about demographics anyway. So where we're asking about age, race, geography, location, like city, that sort of thing. If we add sexual orientation, gender identity, it's just a demographic question, but it's an option for folks to respond to. And we just have to be aware that not everyone is out or completely out, and some people are at different levels of their outness. And so collecting the data may be a little difficult, but we have to at least start asking so we can know where we are with folks. When we were having conversations about contact tracing with our listening session, we had a small discussion about contact tracing as it relates to the gay, biromantic, and men who have sex with men populations, in that this group hopefully is used to being asked about sexual partners and activities, and perhaps doing contact tracing when it relates to HIV status or STIs and STDs. And so in one sense of the thought is that this community should be okay and used to sort of going back in history to find out like who they've had contact with and answering somewhat maybe personal and invasive questions to make sure that epidemiologists can get the work done. And so when it comes to a vaccine and reaching the LGBTQ community, it's really just like any other community. You just have to do sort of targeted outreach. We haven't heard of any concerns that people are having that's necessarily related to their sexual orientation and gender identity. But we just have to keep intersectionality in mind. And so when it comes to Black and Native Indigenous populations, we have a sordid and storied history when it comes to healthcare providers being experimented on, when it comes to just abortions, STDs, just any sort of thing like that that might prevent people from a historical perspective from being wary of wanting to get a vaccine or be first in line to get a vaccine. And so we haven't, again, really noted any concerns related to someone's sexual orientation and gender identity. And so that in and of itself may not be a particular concern. But reaching out to the community, we're learning that folks really rely upon their trusted sources. And so the center, Gender Justice, our center, which is the LGBT Center up in Reno, Human Rights Campaign, Service Data Quality Institute, Transgender Allies Group, these organizations being trusted sources for the LGBTQ community for information when it comes to maybe vaccines or just information about COVID in general. We had one conversation, one of our listening sessions about when it comes to marketing and outreach, just to be creative and to speak to the community in a certain way and to engage them, but also don't want to use stereotypes or tropes in messaging or in marketing materials. And it's always the case where providers want to reach the LGBTQ community or any other minority population. And so they're quick to, add a pride flag to a flyer, put LGBTQ, like we're looking for you, but really haven't done the work to train up their staff, to look at their internal policies and procedures, to make sure that they are really ready to do that outreach to the LGBTQ community. So if anyone's looking to do that work, I encourage you to engage with a subject matter expert on it to make sure that your organization is truly ready to do some outreach to the LGBTQ community. And I'll just leave you with a quote from Miss Janet, if you're nasty. She says, "In complete darkness, we are all the same. It is only our knowledge and wisdom that separates us. Don't let your eyes deceive you." And so, sometimes our sexual orientation or our gender identity may be a factor, and sometimes it may not. It really just depends. And so it's really good to engage with people and have conversations and not be afraid to talk to someone about their sexual orientation, because for some people that's a core part of their identity, or even if it's a secondary or tertiary identity. If we're going to do some whole person work, we need to get into a space that we can ask people about their sexual orientation and of course their gender identity when it relates to trans and other genders that people might identify with. So thank you for your time and glad to participate today.
All right. Well, thank you, Andre. We all love Ms. Jackson, right? Our community is so fortunate to have you. Our final speaker is Dr. Jason Flatt. Dr. Flatt is an assistant professor at the UNLV School of Public Health. His current research works to better understand the risk and protective factors for Alzheimer's disease and related dementias among sexual and gender minority seniors. Dr. Flatt has an NIH Career Award on risk and protective factors for Alzheimer's. He also co-PI on a pilot study from the NIA's Research Center Collaborative Network exploring cognition and gender trends in 3 American generations. He currently has 30 publications in the fields of aging, dementia, and sexual and gender minority health. For the past 10 years, Dr. Flatt has leveraged his platform as a public health researcher to work as an advocate for the LGBTQI+ community. To further the reach of his advocacy efforts, he partners with Interact Advocates, SAGE, Los Angeles LGBT Center, and Center on Halsted in Chicago, Illinois. He is also partnering with several community organizations where he created the Building Healthy Outcomes using a supportive environment for LGBTQ older adults, which will examine the influence of affordable housing on the health of LGBTQI+ older adults in San Francisco, Los Angeles, New York City, and Houston. His work has been featured in the San Francisco Chronicle, US News and World Report, NPR, Newsweek, as well as on international outlets. Adults aged 60 and older are one of the fastest growing groups, including those identifying as lesbian, gay, bisexual, transgender, queer, and intersex in the United States. Dr. Flatt's hope is that his current research and advocacy efforts will shape the training of care providers, creating a more inclusive aging environment for LGBTQI+ individuals. Dr. Flatt, the floor is yours.
Thank you so much for that introduction. It's really a pleasure to be here today with all the great speakers and learning about what we can think about for our community in terms of COVID-19. So today I wanted to highlight a little bit about some concerns for LGBTQ+ people as they're aging. And we know that older age is one of the risks for people that may experience complications from COVID-19 and also increases their risk of mortality as well as other disabilities due to COVID-19. So I wanted to talk a little more and let you know why we should be thinking about our LGBTQ+ seniors and those who are 50+. So we had already mentioned, we're seeing this as a great growth in the population in terms of the number of adults in the US who identify as LGBTQ+ and are 50 and older. Current estimates are around up to 3 million people in this country are currently 50 or older. Why this is also a concern when we think about in terms of COVID-19, what's going on is that LGBTQ+ older people are more likely to live alone. So they're actually up to 3 times more likely to live alone compared to their heterosexual and cisgender peers. And because of historical discrimination, so not having the right to be married, not having the right to adopt children, right? And some of these concerns are still happening today. Because of these structural issues, many LGBTQ+ people don't have a caregiving support system, much like their heterosexual and cisgender peers. So sometimes they're distant or no longer close to family members, and also they may not have children or others in their lives. So they may have to rely on some of the non-traditional types of caregiving that may not provide some of the same sort of quality. So they might rely on a neighbor or a friend, but with COVID-19 right now, I don't know about the rest of you, but I haven't seen any neighbors recently. So that can be a huge challenge. We also know that LGBTQ people, especially those who are 50 and older, have experienced a lifetime of stigma, discrimination, and trauma. And this is especially in terms of healthcare access. It wasn't long ago that being a sexual minority or an LGBT or queer person was considered a mental health disorder, right? And then just only the past couple of years did they finally change the DSM criteria to no longer consider transgender people having a mental health condition. So because of those historical issues, they may be less likely to want to seek out healthcare because they've had terrible experiences in the past. We also know that there's unique challenges for our community in terms of, and other speakers have talked about this, but in terms of intersectional identities. So we can think about this in terms of racial ethnic minorities, or even for our gender minorities who may not even be welcomed into some of the broader LGBT community. So because of these issues, it's made it a lot more challenging. But one of our, I believe Andre brought up the piece around the fact that our community is resilient. We've learned a lot from overcoming the HIV/AIDS epidemic. We've learned how to bolster our community support and rely on one another. So during this time of the pandemic, we need to return to some of those strengths and really rely on the support systems and the community that we have worked so hard to build. So today I wanted to give you a little bit of tips and think about what are the resources that are available to you right now that you can access if you need more support. And also think about these for people that you may know that are looking for support or ways to better connect with their community during a time when we're all having to stay home. So some tips on dealing with COVID-19. I just wanted to highlight a few things that you should be thinking about. So first, social isolation or not having contact with other people can be really hard right now. So developing a support system, that might be choosing a contact person or a friend that you can regularly check in with, right? Having a buddy or someone that you check on each other to see how things are going. During this time, you might want to think about setting up a regular check-in plan. So for instance, one example is I'm actually talking with a friend and we do check-ins where it's like we check on each other in the morning and then we also check on each other in the evening just to see how things are going, let them know I'm thinking about them, but also it's an opportunity for them to know that I'm there for them if they need me. You may also want to consider creating a list of contacts of family and friends. So let's say, for instance, you have a health concern where you're not going to be able to reach them. I encourage you right now to have sort of a plan set in place. If people need to reach out to family or friends, consider putting that information somewhere that's visible. Maybe that's on the fridge, maybe that's next to the couch where you sit normally. Wherever that would be, it's important to have an emergency plan in place. Some other thoughts that you may want to consider, for instance, is if you were concerned about having a COVID-19 exposure, you might want to have an emergency home kit, right? So things like have enough food, resources, medications, any of that that you might need if you need to stay home. So it's been recommended thinking about having an emergency home quarantine kit. If you're feeling lonely, reach out to a friend. Think about having, joining a group, and I'm going to share a few of those resources in a moment, just so you can still stay connected. I know we're all relying on technology more, but I think also these one-on-one interactions are especially helpful right now. They can boost your mood, they can give you ideas of other activities to do, but it also is important just to connect with others and think about how you could help them out. Another recommendation that could be really helpful is to look for helpers, people that could help you out. Maybe that's a friend or family member who's running to the grocery store and can drop off some items that you might need. Any of that. So right now it's really about reaching out to our support systems, but also enhancing and really strengthening those relationships since we're not seeing each other in person as much. So some other resources that I wanted to share with you that are national, I wanted you to think about a few of these and learn more about how they could help you out. So for instance, one of the national resources for older adults, especially those who are LGBTQ plus, is the SAGE hotline. So here I give you the number. This is a hotline, it's available, it's 24/7, it's toll free, and really they're targeting there for LGBT people who are older. You can talk with someone who's friendly, you could ask questions or get suggestions. And so some unique pieces of this SAGE hotline is they're certified to handle and help you solve experiences when maybe you're having a crisis. They can also offer you some support if you need help thinking about decisions or where to find resources. They'll keep the information that they share with you confidential. But the great part about this hotline is they are well connected and they know about resources that you could access. So things like healthcare, transportation, counseling, legal services, or even if you wanted some support programs to help with, how you're feeling right now. So that is all available to you. If you're looking for a way to connect with other people and want to do that, there's a new program that was launched at the beginning of the pandemic called Sage Connect. And Sage Connect is really wonderful in that it links LGBT older people with broader people in the community who want to maybe be connected to someone. So for instance, I participate in this program and I talk with a LGBT person every Tuesday. So it's a really great opportunity. And this isn't just matching, say, for instance, you're an older person and you want to use this program. It's great that they match you with people of the same age or of common interests. And really the goal is just to connect with someone and have a conversation. And hopefully, you can both boost each other's mood, help with your feelings if you're feeling lonely, and also learn about ways that people are coping right now with the pandemic and having to stay at home. Another program I wanted to share with you is the Caregiver Connect line. So this is a really great program offered by the Family Caregiver Alliance. And so if you're a caregiver right now and you're stressed about how much more difficult it is to provide care to a loved one during the pandemic, I encourage you to check out this resource. They have tips, but they also have access to support groups. So maybe you want to join a local or a national support group to learn about some of the strategies that people are using right now to care for their loved ones during this time. So I encourage you to check that out. There's also another link I wanted to encourage you to check out is the LGBT Community Support Program. It's a caregiving program for caregivers, and what it does is allow you to connect with other people who are currently doing care, right? So it's a support group where you could strategize about problems and solve them, but also connect with others. And then the final one on here that I encourage you to check out is a 24/7 friendship line. This is a really unique line. So it's offered 24/7, and it's both the help if you're having a really hard time right now, or you're just looking to connect with someone. They offer, daily phone calls if you would like people to give you a call. They offer emotional support. They can actually help you with reminders around taking medications, as well as if you don't have someone, I had talked about having someone to do a check-in with. Well, this program offers that as well. And so this line has been going on for a really long time. The friendship line started in 1973. And back in 2012, they've actually seen a growth in it. So they have staff and volunteers maintaining this line. They actually make, nearly 36,000 outgoing calls a year. And this is a program that's supported by the Institute on Aging. And so it offers some really great services, and it is accredited. So if someone, for instance, was having maybe a mental health crisis or feeling really down, there are trained people that manage this line that could help. So I definitely want to encourage you to check out that resource. It's a really wonderful one, and they can also help you just with finding out more about resources in the community. Some other national resources I wanted to encourage you to check out are really tailored towards trans people and also older adults. So the first one is the Trans Line. It's a national online transgender medical consultation service. So it offers information about healthcare options. You can learn more about clinical information, but also you can learn about resources that are available. The next website is the LGBT Aging Center. This is a national resource center where you can learn a lot about health information that's particular to the LGBTQ community who is getting older. It also has really great resources in terms of accessing other services. So maybe you want to sign up for Medicare, or you want to learn about some other healthcare options that are out there. This is a great resource. The next one I wanted to encourage you to check out is the Trans Lifeline. Trans Lifeline is a nonprofit that's dedicated to the well-being of transgender people. And so they run a hotline, and what's really unique about this hotline is it is staffed by other transgender people. And so they really focus on the fact that this is staffed by transgender people for transgender people. So this lifeline, it's really based on volunteers, and they're there to help you with whatever support needs you might need. And they're very well connected. They can find resources for you, but it's also just great to have a friendly voice on the other line of the phone to talk to. And then finally, if you're looking for information more about health services for older adults, there is the Elder Care Locator. And so this is a public service that's offered by the Administration on Aging. And so it's a nationwide service that can connect older Americans and their caregivers with information about senior service programs. This can be especially hard right now with the pandemic and a lot of the programs being closed right now. So utilizing this resource can be especially helpful to learn about what services are currently out there that you could access. The next one I wanted to highlight that I think is really important is the one by the Human Rights Campaign. So if you're currently looking for a healthcare facility that's going to be inclusive and welcoming to the LGBTQ plus community, I encourage you to check out their Health Equality Index. So this index will share with you about healthcare facilities that are currently inclusive and addressing the needs of the LGBT community. So I encourage you to check out the website on the bottom of this to learn more. Finally, I wanted to highlight some local resources that you may want to consider. So many of our other speakers today are actually from these organizations. They've talked about the great services of the Center of Southern Nevada that's really addressing the needs of our LGBTQ plus community. And so I wanted to highlight just some of the unique programs that they're doing right now. So they have a peer-led support group called Latecomers. This is for people who are age 40 and older who may want to learn more or even support others who are currently coming out. So the program is really around building friendships. So I encourage you to check that out. I know they've been doing some web-based programming, much like today's offering on Zoom. So I encourage you to check that out. They also have programs such as Living Well. It's a program focused on health and learning more about resources for our gender diverse community. They also offer health services, so that's something unique. You may want to check out some of the services that are offered at the center. They have counseling services as well. So Affirmations, it's an LGBTQ plus affirmative counseling program. And then finally, we know many people are struggling right now around income and access. They may be experiencing food insecurity. So I encourage you to check out the programs offered by 3 Square. There are many sites in Southern Nevada that are offering, food for our community. So I encourage you to check that out as well. Finally, if you're looking for specific aging services here in Southern Nevada, I wanted to encourage you to check out Nevada Can. Here's a website and it offers some resources specifically focused on COVID-19 right now. So there's actually a toll-free service. If you dial 211, you'll actually be connected to Nevada's Department of Health and Human Services call line. And what this focuses on is helping you identify services that you might need. So it's a really unique service right now for seniors. There's also the Nevada Aging and Disability Services Program. So if you're looking for programs locally, this is really unique in that it addresses the needs of people living with disabilities. It helps support their families and caregivers, as well as it's offers programming and support for older adults who are living in Nevada. So they call it sort of their one-stop shop for learning about aging and disability services in our state. And then finally, if you're encountering any legal issues or want to just learn more, I wanted to provide you with the number to the Nevada Legal Services. Finally, I know we're all concerned right now about exposure to COVID-19, so I wanted to give you a link to some resources where you can find some of the current testing sites. So here's a link to that. Some of the common places that they're currently offering are through the Southern Nevada Health District, as well as at UNLV at the Thomas and Mack Center. So thanks so much for having me today. It's been a real pleasure to talk to you. I just wanted to encourage you to definitely check out these resources. If you're in a time of need and you're looking for someone to reach out to, definitely check out SAGE's hotline. They're really supportive. It's also staffed by volunteers and experts. And if for some reason you need to reach me, I put my contact information, and some of the resources I've talked about are actually available on my website, which is rainbowsofaging.org.
All right, well, Dr. Flatt, we thank you for your presentation and all of the work that you are doing. Those are some incredible resources, and I really didn't know there was that much out there, so I'm grateful that you have shared that. And I want to say thank you to all of our panelists who have all presented such vital information around this subject. I want to say thank you again to our sponsors, the Nevada Minority Health and Equity Coalition, UNLV School of Public Health, Nevada Office of Minority Health and Equity, Nevada Commission on Minority Affairs, UNLV Center for Health Disparities Research, and Dreamsicle Kids Foundation. With that, I'd like to take a moment for some questions. Jose.
Yeah, just anybody, if you have questions, you can put them into the chat or submit them, and we will get them to our panelists. And I think right now, actually, Will's going to start us off with a couple of questions.
Wonderful. Well, if I could ask all of our panelists to join us via video again, so we'll all be a happy family here. And then just feel free to unmute when you choose to answer. Doctor, I would like to start with you, Dr. Chapel-Love. How has your work changed and transitioned since COVID-19 began? Had to do social isolation.
You want to see what she wants for Christmas? She just wants a hoodie.
I think somebody might have their mic off, but to answer that question, I think a lot of mental health providers ended up transitioning really rapidly. I know I, in particular, was on a business trip to DC in March and then came back, and then we were almost exclusively telebehavioral health. So typically I'm used to being, even the phrase, in the room with a person is how I usually see folks, but now it's a lot of telebehavioral health. There's a lot of, as Dr. Flatt got into, resources for folks that can't leave their home or resources for folks who are worried about leaving their home. It's transitioned greatly in the last 6 months. I've gotten adept to doing therapy like this if I am in a room with a person, and that is not to put too fine of a point on it. It's kind of weird being able to recognize how much I rely upon facial expressions and, oh, okay, things like that, as opposed to they can just kind of see my glasses fogging up slightly. And so I would say it's changed dramatically.
Would you say that there is a psychological impact more from the clinical perspective due to having to socially distance and not be able to be in the presence of people? Great resources like the Sage Connect, of course, exist, but is there an actual difference between that in-person connection and virtual connections?
I mean, my goodness, yes, there's an impact, but what we're finding is that telebehavioral health outcomes or how well people do if they're only engaging in telebehavioral health, meaning via Zoom or Doxy or however many other places, that it is being positively impactful. So I definitely don't want folks to worry, you know, gosh, if I can't meet someone in person, then I might as well just not meet with someone. I don't think that that's been accurate in either the research and certainly not, you know, what I've seen. Being able to connect with someone, we have different ways. I know a lot of clinicians, you know, seeing folks from their home, and you get to see the patient or the client's pets and things like that that you've only heard about. So I think it's actually pretty cool to be able to connect with people on their home base, where oftentimes they're more relaxed because they're not sitting, you know, in an office.
That makes a lot of sense. Thank you so much. And Vince, since you are frontline with the community, what are you seeing as a result of the drop off in attendance, particularly among your seniors? What are you seeing as far as those social connections and them being maintained?
So yeah, it's a big difference. You know, the seniors would show up at 5 days a week, and they would have their designated day, Monday through Friday. And it was social hour for them. And they were here for educational lunch and learns and card games and board games and potlucks and just a whole community. It's about community. It's about community engagement with one another, building community. So to basically get the rug pulled out from under them, I mean, like I mentioned earlier, 100% of our on property activities for seniors has gone away. So the work is that we as a staff are trying to find ways to engage with them. And I like what Jason had, the suggestions around the check-ins and having the, you know, just the list of information that, and having people buddy up and connect and stay connected. Those are all things that I do actually. You know, I'm 58, so I'm right in there. But you know, again, our staff is really working hard to try to stay engaged with our seniors, and making sure that their essential needs are met best as possible. But there's still a lot of work, and you know, we're seeing a lot of strain as a result of it. And you know, seniors want to have a life too, you know, and they want to figure it out. But it's a challenge.
Certainly. And Dr. Farr, you mentioned so much about disparities and how it impacts LGBTQ plus people. What are you seeing right now as far as how these health disparities are impacting healthcare overall in this time of COVID-19?
I mean, certainly, I think we've had a lot of issues with just people being able to access healthcare, right? I mean, when it first started and we're having shutdowns, people couldn't get preventative, you know, screenings and all that sort of stuff, and that's gradually coming back online. But you know, we see that people who maybe have recently experienced unemployment and they've lost their health insurance aren't able to access care. I mean, people are really, you know, concerned as we're not getting, you know, they're not getting more stimulus checks and things like that, about spending money to go see the doctor or having that money in pocket to buy food, you know, the next week and things like that. So we certainly are seeing, I think, you know, as we can, you know, hypothesize about this right now, but as we get the data, I think we're going to see that, you know, there's greater disparities between what haves and have-nots, right? People who have consistent job, money, they're going to be able to continue their care, you know, maybe a little delayed because of shutdowns and those sort of things. And then people who are really worried about their jobs or have lost their jobs. I have friends in the entertainment industry who've been without work since March 15th in Nevada, you know, and we don't see any end in sight, right? So I think we're going to see huge disparities that are just going to get bigger and bigger and bigger during this year. And as we study this, I think will be, you know, be shocking probably in some of the disparities that we do see.
Yeah, I definitely can understand how that would be the case there.
Mm.
Andre, you have been in this work, and this was news to me. I didn't realize it had been over 20 years. So, wow for that. how do you stay motivated, particularly when things are as difficult as they are politically and economically at this time?
That's a good question that I don't think I've been asked before. So I don't have a set answer for you to go from the dome. So I'll speak from my heart, and I'll just say that this is work that I dedicated my life and career to. And so I don't really know anything but to try to be of service in times like this. And what gives me anxiety and what I think what upsets me most is when I feel like I don't know where to help or how to help. And so what I try to do is be creative with seeing where there might be a gap in what people are doing, or just provide my voice and support where it might be needed. And so I'm happy that Silver State Equality and our affiliate or parent organization, Equality California, that we were able to pivot when COVID happened for them on the Equality California side to create a COVID navigator with a statewide hotline and resources and a website for folks. And then we were eventually able to get funding through this project. And so we're able to pivot in these ways and be nimble. I think if we weren't able to, then I think my anxiety would have gone up and I would have felt a little helpless, but I'm glad that we're able to do something in solidarity with our colleagues.
Well, thank you for just coming up with it on the spot. I mean, that's an impactful answer. So always speaking from the heart, I appreciate that. And Dr. Flatt, this one is for you. With the increased stress and burden on caregivers, what have you seen and what have you offered that has helped to undergird them and keep them engaged? Is there a particular support group that you recommend? I know you listed several, but for the caregivers, is there something specific you'd like to highlight?
I mean, I think first for the caregivers, it depends on, the illness or challenges that their loved one's facing. So a lot of it can be joining a support group. So for instance, there's one specifically through the Alzheimer's Association, or there's groups that are specifically targeted. So I gave the link to the Family Caregiver Alliance group that actually has an LGBTQ support group. This is for people who are experiencing challenges. It could be the caregiver has to work, right? And how are they going to navigate this and think about home care? Who can check in on their loved one? That can be especially challenging. It's also a time I had mentioned, where we're returning back to the times of when we had the HIV/AIDS epidemic and really relying on our community. Some of this now can't be done in person just because of the safety issues around exposure to COVID-19. But I think it's a return to kind of these meaningful connections and also reaching out to your support system in different ways to help you. And I think one of the things I've heard from people is like becoming a little more humble. And this idea of like, well, how can I help others? But also, and sort of this collaborative thing of like, how can we help each other? And it's a return to kind of that type of thinking of like, I'm going to the grocery store. Let me check on my neighbor, or let me check on my friend if there's anything they need. And this may not be a typical thing, but many people have to stay home because of concerns. So I think it's a return to kind of relying on our LGBTQ plus community to support us. And so that's what I've been hearing most people talk about.
Thank you.
Mm-hmm.
So each of you is ultimately involved in what I consider to be compassion work, alleviating the suffering of others, making the world simply a brighter place. I'd like to go in the order of the panelists with the same question. And this is simply, What brought you to where you are today? What connected you to your work? What inspired you to begin what it is you have spent your lives doing? So Dr. Farr, if we could start with you.
Sure. I guess this sort of started when I was working on my doctorate in public health. And my dad is a person with a disability, he's paraplegic. And just seeing really the difference in the quality of care that he was receiving because of being in a wheelchair, not being able to get up on the exam table and those sort of things. And that really started the ball rolling with me looking at health disparities. You know, why is it that some people, simply because of maybe an ability or a race or ethnicity or an identity, why do they receive worse health care? And really trying to shine a light on that, because I think a lot of people just never realize that that happens, right? But we have to know it before we can do anything about it. And like people with disabilities, you would expect that they would have great access to healthcare, right? Because they have to go to see the doctor more often. Well, actually, they have terrible access to healthcare. And it's like shining a light on that, right? You know, LGBTQ plus people, they experience health disparities just simply because based on their orientation and identity. And we have to shine a light on that first and then start working to alleviate that. And that's really what brought me into this work. Thank you for asking that question.
Wonderful. And thank you for all that you are doing.
Thank
and
you.
Dr. Capel of Love, how about we go to you?
Yeah, I think I shared, I do that sexual health research, and the married name just kind of fell into place with the whole Dr. Love thing. So to share that, how am I here? My village. I don't think I'm any more exceptional than anybody else. I come from lower SES background, and a lot of these disadvantaged backgrounds and all these other things that I think we all are so familiar with in research. And I think why I'm here now is because if I'm writing a research paper, if I'm reading something, I am in the community. I am in, these communities that I think we can all highlight and understand on, if I'm reading a paper about disparities and lack of access and things like that. So to me, I'm here because I've had amazing family and my village and privilege and people to support me, as I am. And I think that I ended up striving and taking that really long road to be a psychologist. And it was in fact a long road, and we can talk a lot more about educational barriers and things like that. But I ended up being here because to me, it's not just work. It's not just research. It's the community I live in. It's the communities I want to serve. I think one of my major jobs is, if I reach a different rung on a ladder, is to turn around and reach back and pull 2-3 more people up here with me. I'm afraid I'm going to flagrantly plagiarize Andre and say I couldn't imagine anything but to be of service. So that's why I'm here. And I might also steal that Miss Jackson, if you're nasty, slide, because that was just that was just awesome. So thank you, Will.
I'm picking that one too. So thank you so much. Vince.
Wow. So yeah, I think the seed of compassion and service was planted in me when I was a kid. My grandmothers were very much a part of the community in which, they reached into the community, and, they took the apple pie next door when the containers of soup when someone was sick. They worked the voting polls. They instilled in us, service was, the way. But fast forward to I moved to Las Vegas in 2006. And I moved here from San Francisco, and I immediately saw the drastic differences in services in public health, particularly HIV/AIDS services. And I literally started writing letters and advocating for better services, and just putting one foot in front of the other, and which led me to a life in, of public health, which is in complete contrast to my former life. I was a professional ballet dancer in my other life. So it's been an interesting journey, you know, but I think at the core of all of that has been, you know, really wanting to feel connected to my community and wanting to help, you know, because this is where I live, and you know, and part of being, you know, community is, you know, when you see a need, just roll up your sleeve and get to work, because if you're looking for somebody else to do it in Vegas and in Nevada, there might not be anyone else to do it. So therefore, who else, you know? So many times I found myself in that situation, and you know, I just drudged up the courage to say, okay, I'll try.
Well, we thank you for your courage and your commitment. So
Thank you.
beautiful. Andre.
Yes. I do this work because I was bullied when I was younger. So probably like elementary through probably high school. And so about the time I was 14 or 15 is when I decided that I wanted to help others. And I didn't know what that meant exactly. I just knew that I wanted to be there for others because I felt like I didn't have anyone to turn to. And so and I think that's why I do a lot of advocacy for issues that don't have anything to do with me or part of my experience. I just sort of empathize and can understand with people's struggles. And so, you know, what happened to me as a young person for those years were very traumatic and really changed the trajectory of my life. You know, I was going to be a triple threat pop star, and yet instead I decided to go into this field instead. But it's just been this driving force. And so I've had the fortunate ability or past work history for working in a group home as like one of my first jobs after graduating from college, which drove my parents crazy, and to doing the work that I do now. And so I have like this a wealth of experience to draw on because I've sort of done the work like on the ground and that personal service delivery to families and children. But when I started working with the National Alliance to End Homelessness is when I fell in love with policy. And so I love policy and advocacy and education, being able to hopefully affect positive change on a macro level instead of a micro level. I think micro level is very much important, but I sort of switched gears. But it's always just with the goal of making the world a little better, because I think sometimes our own individual everyday experience can seem so overwhelming and hurtful that it's hard to see the forest for the trees. And so I kind of want to help people see the forest if they only see trees.
Well put. See the forest. Yes, I love it. And lastly, we will have Dr. Flatt go. But before you do, I just want to say thank you again to the audience, to all of those watching by Facebook as well as Zoom. We really appreciate you being a part of this very important webinar. And we'll give the final word to Dr. Flatt.
All right, well, thanks again for having me, and thanks to everybody that's listening. And I really connect with what the other speakers have touched on. There's a lot of, so I also faced a lot of hardships in my early childhood, and I think that those hardships really drove me to wanting to understand more of how people are resilient or how they overcome these challenges. And that really is what connected me to people that were in the later stage of their life. So in high school, I actually worked in an assisted living and nursing home facility doing activities on the weekend. So I called bingo, I organized social events, and it was one of the best. I used to think like, how do I get paid to do this? It was really a rewarding experience for me. I was still in the closet at the time, 17 years old, and I just felt so welcomed and embraced. No one cared like about my identity. Really, they were just happy that I was there. And so with that, and then as Vince had mentioned, I moved to the San Francisco Bay Area with my husband, and I spent 5 years there. And I had been already training to be a gerontologist and do research with the aging community. And I started to think about, like, where can I help most? And so I started connecting with the LGBTQ community in San Francisco and learning about their needs and connecting with them more on a personal level. And that really drove me to, like, this is the work I want to do. These are the people I want to help. This is something I can take my training, I can take the resources, the networking that I love to do, and bring that back and share it. And that's sort of why I'm doing this. So.
Awesome.
Yeah.
Well, to our panelists, thank you again for joining. And I will leave you with this. Be the change you want to see in the world. Spread compassion, not COVID. Jose, would you close us out?
Yes, sir. Thank you, Will. Thank you, panelists. Great session. Everybody still listening, thank you for signing on today and being with us. We have several other sessions that are going to be coming out to close out the month of November and into December. And so please look for those announcements. And thank you, everybody. Stay safe out there, and let's all keep doing what we can do, especially with the new administration coming in, that we can do all our part to be ready for any new things that might be coming our way and get this thing back on the right path. So thank you, panelists. Thank you, Will. And everybody stay safe, and goodbye, everybody.